Good afternoon. I'm Phil Polikoff. Healthcare on the Farm, taking control is on. Do me one favor, buckle your seatbelts because we're going to take off on a fast pace. And this is your show, not ours. So we want to make sure all of you are participants. We're going to show you a few slides to set the scene. And then we're going to have some dynamics on the stage between our great panelists. And then it's all about you. So you're going to try to share with us your feelings and give you a little bit about a history. I did grow up not in the heartland. I grew up on the East Coast, but my first exposure professionally was as a farm person in New York, and I did go to agriculture school. So I do feel a kinship here, and talking with you folks has been very, very positive to date. So here we go. Are you ready?
Ready.
This is an old definition of health. It's broader than just health care. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This dates back 70 years, and we're still having a challenge trying to meet the needs, and you'll see that. With this, it's the best of times and the worst of times, and all of you have experienced this. And keep in mind, most of you are looked at as patients, some of you look as consumers, and rarely are we looked as a person. So it's really important that as we move forward in this changing environment, we're seen first as persons, then consumers, and then patients. Very important to be a patient that's well respected and treated correctly. But we've had the best of times. There's great changes occurring in healthcare. There's innovation. There's better pharmaceuticals. But with that, there's the downside. And the downside is most of what you people are experiencing. The cost is overwhelming. The fragmentation, the inefficiency, the ineffectiveness, the political fabric going forward. So also combining public health issues of the water pollution, air pollution, soil pollution, as well as what it does impacts on illness and the social determinants. So we're going to try to touch upon all of those as we get forward. And as you can see, it's a complex issue, but the bottom line is you want better care, better health, at a lower cost with personal satisfaction. You'll see that in our next slide. So this is the next slide, what we call the quadruple aim. Lucas, any quick comments that you wanted to put forth on the slides today?
Yeah, no, I think a couple things, and I guess we'll quickly give our backgrounds too, but as a farmer, as someone who spent 15 years in healthcare as a profession, this is something, this quadruple aim of improving cost, quality, satisfaction, is something that the industry strive for a long time, and quite honestly we're failing at, as evidenced by what your experience is. One of the things that we've talked about quite a bit around the feedback that we've gotten from members over the years is how do we help us understand, help us navigate the health system. And so I think we want to have some fun dialogue to where are we at in the system, where are we going at, where are we going to in the system. Okay,
moving forward, farm families spend $30,000K, and we heard from someone from Iowa that they're spending $40,000K a year now in healthcare. It's more than it can afford. Another person told us that his mother had to go back to work off the farm to provide healthcare for her family. So with that, 3 out of 4 farmers surveyed reported health insurance as part of their risk management strategy, and that's critically important. And I think FBN is trying to take charge of that issue as an important issue in their own development. The rest is physician shortness, but I would even put that further. It's not just physician shortness, it's the whole issue of care provider shortness. We do not have enough community health workers, we don't have enough social workers, we don't have enough pharmacists, and on and on. So we really do have to support and engage more people in the delivery of healthcare in a meaningful way. So with that, let's turn it over to our August panel. We have people representing the entire viewpoint. They each get 10 seconds to introduce themselves, and then the order we're going with is our famous mental health person, then we're going into our community activists, then we're going into our person in telemedicine, and then we're going into the person delivering care of the insurance product. And especially then we also have Lucas, who's trying to put this all together in a very positive way. So with that, let's go through our quick introductions, and then we know how we're going to order it. My friend here, Ted's first, then Rachel, then Patrick, then Dan, and then Lucas. We'll try to summarize it. So let's start with our quick introductions.
Very good. Well, thank you. My name is Dan Whitney, the president and CEO of Medova Healthcare, based in Wichita, Kansas. Farm boy by nature, grew up in Concordia, Kansas. So very familiar with obviously the small farm communities. and doing a lot of things in the healthcare space, background in physician practice management through an integrated delivery system, and now we're a TPA offering small to mid-sized employers with healthcare solutions for their, for the health insurance coverage. So a lot of background in all the different aspects.
Ted?
I'm Ted Matthews. I'm Director of Rural Mental Health for the state of Minnesota. I have been practicing working with farmers for the last 25 plus years, and I need help. So I hope we can find some solutions and get some more people to do what I do.
Rachel?
Rachel Hartford from Lawrence, Kansas, and I represent federally qualified community health centers, or as many would know, community health centers. I did not grow up in farms. I did not grow up around farmers, but I grew up in a family from lumber and the mill business, and so I also grew up with families who were self-employed, and so I understand the challenges when it comes to access, and so community health centers really help to bridge that gap when it comes to access and cost, and so passionate about community health, passionate about access, and it matters.
Pat?
Yeah, great. Patrick Bregman, thanks for having us here today. Hopefully, as Ted mentioned, we'll be able to have some great dialogue about good solutions to some very real problems that all of you face. I represent Avera eCare, which is a telemedicine organization based out of Sioux Falls, South Dakota. Really, our primary goal is to help try to solve things like physician shortage and give you access to care, whether that's through primary care vehicles or all the way through intensive care service within your hospitals. Access to care is a real cornerstone of our mission, and so I'm excited to be here today to have this discussion.
Luke is shorter than the rest?
Absolutely. Lucas Strom, head of our insurance businesses here at FBN, a farmer, and I'm a recovering healthcare executive from a couple of healthcare companies back in the day.
So let's turn it over to what we're going to talk about. And we're going through, first we're talking on a major issue, mental health, not just mental illness. It's a very broadband issue that's not been addressed to a sufficient enough degree. And Ted really has traveled the state of Minnesota to deal with this issue in many different ways. So Ted, your thoughts on mental health and the needs there?
Well, I think farming has changed so drastically over the last 50 years. I don't think people even really see some of the major differences and changes. The number one issue that I've seen, the number one change that I've seen over the last 50,000 years in farming is women. Women on the farm forever worked on the farm, they work in the home, and their job was to raise little farmers. Now, just in the last 25 to 40 years, they're working off the farms, and they're doing something that they never did before, which is the books. And when women do the books, they develop this thing called an opinion. And with that opinion comes all kinds of conflict oftentimes, not because they can't work it through, but because they didn't have anyone to look at to say, Mom, how'd you do it? Dad, how'd you do it back then? Because they didn't do it that way. So working together becomes really difficult. Working off the farm for reasons like health care, insurance, and so on becomes a really, really big issue. And being heard. You know, I truly believe that this room, if I was having the same conversation 50 years ago, there wouldn't be a woman in the room. And a lot of times I deal with just women working on farm and farm issues. So everything has truly changed, and we are not the same as we used to be. When you look at family farm is different. Family farm, how many of you would have said, it would have been a stupid question if I would have said, how many of you have all your meals together 50 years ago? Now, how many would have their meals together? Very few families have all their meals together because there's so many other activities going on. So it becomes more and more stressful, and we need to focus on the concept that it's mental health and not mental illness. And everyone can be healthier, and mentally healthier is a positive thing. Stress on the farm, most farmers don't realize that stress is 12 months a year, because if it works out, it doesn't seem to count. When you go to the bank and you get an operating loan and you have to have your books in order, stressful. When you finally get that, then you have to plant, and like this year, I saw all these farmers standing at the edge of their fields, revving up their engines, waiting for it to get warm enough so they could take off out there and put the crop in. Stressful. Then when they get the crop in, is it going to be too wet? Is it going to be too dry? Then they have to spray. Do they have to spray for aphids? On and on and on. Stress, 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 stress. And they go through the whole process, and then they get to the time where they can take in the crop, and the yield, is it going to be good? Are they going to have a decent price? And let's say they do, then hallelujah, praise the Lord, and now they've got to go in and get another operating loan. So stress on the farm is always, and just because it works out oftentimes, doesn't mean you haven't been through a lot of stress. And I've already talked longer than I was supposed to, so I'll
Right,
move
well,
it
we're
on.
being polite. And now we're going to have our demonstrative, the person representing the majority should be talking next. Rachel? Not Juice. Rachel,
Yes.
you're on.
Oh, okay, well, here I am. So one of the things that I oftentimes rally around is the fact that healthcare costs so much. A fun fact, and it's not really that fun, is that America spends the most on healthcare, on our healthcare system, out of any 12 industrialized nation in the world. We spend the most money, and we have the worst health outcomes. That doesn't add up. And so when we think about ways to flip healthcare upside down, we have to start getting serious about prevention. And so community health centers, we rally around prevention. We rally around whole person care, being patient-centered. I think you said it correctly. If we're not listening to the patient, if the patient is not engaged, then nobody's going to make any change to help improve their health outcomes. And so community health centers, we actually exist all across the country, and roughly half exists in rural areas in America. And so I would bet that at least 1 of 7 in this room has stepped foot in a community health center, and you might not have even realized it. We're not a hospital system, and we're not a private practice, but we do try to close the chasm that exists, because at the end of the day, healthcare does cost a lot of money. And so one of the ways that we oftentimes, we want to go where, and I hope that you appreciate this, the grass is browner. We want to go where nobody else kind of wants to go. And the reason why is because, and you'll hear about this on the panel, is what's ahead is we've got to get creative, and we've got to remain innovative in a system that has a lot of barriers and a lot of challenges to navigate. We got to get creative on how to take healthcare to people and how to listen well. And so we get really excited about finding ways to be innovative in healthcare. And at the end of the day, when we think about healthcare, it's more than just your biology. It's where you eat, where you sleep, where you worship, who you surround yourself with, what kind of stressors are in your life. The social determinants of health, it matters. And so when we look at our farmers, when we looked at communities who might have a gap in care, we have to be talking about those things.
Lucas, you want to slip in a quick word?
No, I mean, I love that, and I'm sure everyone in this room is saying absolutely, the rallying cry. How do we, and this question goes out to Patrick and Dan, how do they know? Is it an issue with raising the hand, or is it an issue with, now that I raise my hand, what's the right procedure? Where do people go? Who do they call? What is normal, and what should they do? Because we all know somebody that's dealing with stress right now.
Patrick?
Yes, I think behavioral health and stress and all of those things are, they're prominent issues regardless of whether you're in urban or rural areas. But certainly it can be more acute in rural areas. And leveraging technology, I certainly don't tell the folks in this room how technology advancements have, made things more productive, and you guys leverage that every day as you farm your ground. Technology advancements in healthcare allow, like telemedicine, allow you to have access to a psychiatrist when maybe in your rural community it might be really hard for the local hospital or the local clinic to recruit a full-time psychiatrist to your area. So being able to, and I know there's a big stigma with telemedicine around, do I really want to create a relationship with my provider over a video screen? Well, the alternative, unfortunately, many of you deal with today, is drive 2 hours to the local, to the clinic that has that physician service available. We want to try to stop that, right? In today's day and age, we should not have to have you drive 2 hours to go see a specialist for any level of care. Rheumatology, cardiology, psychiatry, we should be able to bring the care to you regardless of whether you're in an urban or rural community. And technology is a vehicle to be able to do that.
Before we switch to Dan, all of you start thinking about that one question that you've waited your entire life to ask this August panel. So if you have to write it out or get ready, you're on stage in a second. So Dan, and then Lucas is going to give us a few of his very special comments.
Absolutely. So our job is to take all this and package it, make it affordable, make the access easy, and make it easily deliverable so that you can have access to it in your local communities and your local counties. And so that's the challenge, to making sure that that's all happening. But what we're seeing from the employer side of things, and obviously we're addressing this now, as you know, as a farm entity, you obviously run a business, and so it's a business, and the health insurance is a business expense. It has a lot to do with attracting and retaining employees. It has a lot to do with obviously your bottom line and if you do that. But there's a lot of things going on in healthcare that obviously we don't even think about. And we try to integrate that in the things that we do from an education standpoint. Just a couple quick points for you. There's a stat out there that's really compounding to me, and that is that 70% of all healthcare costs in the U.S. are related to chronic lifestyle conditions. So I was saying in my presentations, we found the problem, it's us. You know, things that we do every day drive healthcare and drive healthcare costs because of the chronic conditions we have. And there's a big gap in terms of understanding that. We all probably know who our fantasy football team is. We probably all know who, you know, our favorite sports character or music theater or whatever else is. How many of you in the room actually know what your BMI is? How many actually know what your cholesterol level is? And as you go through these kind of things, there's a basic understanding and knowledge in terms of that really have to put in place from that standpoint. And so the other thing that's very interesting about healthcare, and as businesses, it just compounds us because it doesn't pass logic at all. Healthcare is the only service item that I'm aware of where you don't know the cost of something before you buy it. We don't run businesses that way, okay? But we, as consumers, if you want to call ourselves out of healthcare, we consume healthcare every day in that regard, that we have no idea what we're paying for, what the cost is before we consume it. And so the whole idea of transparency in healthcare is something that is really coming to the forefront, and we really have to get at over time as well.
Okay. Lucas?
Well, you just got me with the word transparency. We're a little predisposed to the word transparency here at FBN. And honestly, it's one of the things I think we can help out with. You know, I look at healthcare to me comes down to three issues why we have problems here in the U.S., right? It's complex. There's lots of stakeholders. This is not a B2B, a B2C type of transaction. Healthcare is forever in your whole life, and it deals with guarantors and subscribers, specialists and generalists, delivery and plan, insurances. The amount of parties or stakeholders involved in the process makes it extremely complex. We're also an employer-based model here in the U.S., and we are all employers as farmers. We're self-employed. So these idea of education, engagement, quite honestly, this is the role that I see FBN playing. We're not the employer, but at least we're somewhat of a network of self-employeds that we can help with that engagement, we can help with that information, we can help with that transparency. Because quite honestly, if you think about any company, a company like Bank of America spends $2 billion a year on healthcare for their employees and subscribers. They have teams full of people educating their employees on what they should do, what they shouldn't do, wellness, those types of who to go to, if they have questions about their plans, how they do it. That infrastructure doesn't exist for any of us, and I'm speaking with my farmer hat. That doesn't exist for farmers. So if you think about from a farmer perspective, this all sounds great, but I need help, I need support, whether it's on the plan side, whether it's my physician, finding my physician, having that conversation. That infrastructure doesn't exist for the independent employee, for the small employee. And so to me, that's key. You know, when we look at FBN, what can be our role to support? Yeah, we can help negotiate premiums on scale. We can do some things, but what we do for everything else we do, go downstairs and tell us what you want out of healthcare. Go to our design board and say, this is what we want. We can directly work with our partner and figure out how we can tailor a plan to farmers and companies. So it's this type of engagement where we're trying to bring farmers closer to this issue and help create some infrastructure to support them. And so I think, I mean, we can go back onto cost, and like you were talking about ownership. Farmers need to own their health too. There is no person, there is no single stakeholder in this process that's at fault. The pharmaceutical companies aren't at fault. The insurance companies aren't at fault. We all have to do better to make this a little bit more effective for farmers.
Okay, it's your turn now, unless you would like to hear them ask each other a question. Do any of you have one question that you would ask to relate to someone else on the panel? And see, if it can be civil, you can be in disagreement, but is there anything you've heard that you didn't like?
I'm going to ask Dan a question. When you think about the plans available, when you think about creating a medical plan, and I'm going to ask Patrick too, because you create a delivery system specifically for the rural area. You create a plan specifically for a certain type of group. What defines that? What's different? What's important? What are you looking at to create something specifically for this group of people?
I think a major driver for us is trying to create sustainability. Too often we try to find the quick fix to solutions. Telemedicine can create an environment where we can deliver care in these rural hospitals, who by the way, we have a terribly chronic problem in this country of rural hospitals closing because they're not sustainable.
Yeah.
And so one way that you can do that is leverage telemedicine as an alternative staffing model, and that can help you reduce your overall costs and make your hospital more sustainable in your rural community. So I view sustainability as a real trigger for the work that we do.
Dan?
Well, it goes down to three things. Number one, doing things to make it more affordable. In terms of just some common sense things that make a lot of, that would integrate into the plans and the services we have. Make it accessible, making sure that healthcare should stay local. Okay, so using local networks, making sure that we have accessibility of local providers, making sure if not, we have accessibility for organizations that can simply provide the telehealth and those type of things as well in the process. And then educating and providing promotion in terms of help me help you. Looking at the wellness side, looking at integration of education in terms of dealing those things. It's much better to be proactive than reactive. As a guy, I hate to go to the doctor, but it's better for me to go to the doctor once or twice a year than simply have a condition that it develops itself than because we're catastrophic. We all wouldn't think about not changing the oil in our vehicles, just from that normal checkup type of thing. But we resist that ourselves because we don't like to go through that. So it's just a matter of kind of accommodating those all together.
I'll give you a pro bono evaluation this year as a doctor. Let me ask one question to all of you, and just show your hands. Is health care in America a right or a privilege? Can I see those who think it's a right, that everyone should have it? Just a couple? And how many thinks it's a privilege? Okay, so I think it's, if you look around, it's about 50-50. Let's not go into the politics of that, because it's a heavy political statement. Who has a question that they would like to ask to this audience up here? No one has a question? Do I have to ask them questions? Oh, we got one right there. Stand up and yell.
You were talking about transparency earlier in healthcare and three major issues. Could you restate those three major issues?
We got a mic coming to you in a microsecond. Repeat your question.
Me and my three?
Earlier, you were speaking about transparency in healthcare and that there were three major issues. Would you please restate the three major issues?
Is that to me the three issues
Yes,
that I
sir.
outlined?
Yes, sir. It
Yeah,
is.
not necessarily the transparency, but if you just think about the complexity, the nature of the business between people that pay for insurance, employers, guarantors, the subscribers, the insurance companies, the pharmaceutical companies, the DME companies, you name it, government, quasi-government companies. That's why it's complex. There's a ton of parties involved in healthcare. It creates a lot of complexity. It's not a simple B2B transaction, a business-to-business or business-to-consumer transaction. Number two, after the complexity is the fact that it's employer-based. We've created an employer-based system, which is great if you're employed by a large company. It's not great if you're employed by a small company or if you're the employer of a small farm or farm operation. All the infrastructure that the system has been built around has been big employers. So we are underserved from an infrastructure standpoint. And the third thing, which I never got to, that Phil started getting to, which I don't want to get into, is simply it's a political rag doll. And so there's uncertainty in the space because it's become that. As opposed to looking for common sense solutions, it's become a political rag doll. And so those three reasons, in my mind, of all the different reasons, spending nearly 20 years in healthcare, those three reasons are why solving the issue, solving the problems is harder here than it maybe is in other areas.
Next question. That was a great question. Who's got one? I see one back here. Can we get the mic to him? Take your time. Don't trip. I don't want to go out there. Yes. You can stand up and why don't you try introducing yourself?
Excuse me?
Just introduce yourself. Who are you?
My name is Warren Strom. I'm actually Luke's father, so don't hold that against me. But on another note, I have a brother that's 6 years younger than I am. He's been a vascular surgeon his whole life. When he came out of school in Illinois years and years ago, he got a Farm Bureau scholarship to pay for part of his school if he would go to a rural community, and he did that. Dixon, Illinois, and Dixon and Sterling, Illinois. He's now 68 years old. He's been trying to retire for the last 5 years. There's such a shortage of doctors in rural communities, he retired, and then he started doing weekends at Decatur, Illinois, and Boone, Iowa, to do emergency surgery on the weekends because they couldn't get surgeons in those rural communities that would be available on weekends. So he's 68 years old. He doesn't want to continue to do this. He knows his skills are not what they should be anymore, and yet he has no one to fill that role. So to be sustainable with healthcare in a rural community, how are you going to attract doctors to go into those communities where their wives want to all live in Yuppieville and they don't want to be in the middle of nowhere? To be sustainable, you're going to have a hospital that can attract these people and make sense out of it. To me, in talking to my brother and seeing what's happened over the last 25 years, that's a major challenge. And whoever can figure that out, I think will make it all work.
Can I take a shot at that one? Although I have great esteem for my colleagues, I'm an older physician than your brother, okay? So maybe I have a little sense of experience on that issue. It's a critical issue. Turns out that to try to recruit physicians who are in med school who don't come from a rural background, it's very hard to transplant them into a rural background. So we're working in Washington State. They do all the training in rural health for those 5 states, including Alaska. New Mexico's doing that. New Mexico, I'll tell you an interesting case story. They recognize the same issue you raised. They send out some of their new residents to the rural New Mexican area. And it turns out after the 2 years of service for their loans, they come back to either Albuquerque or, believe it or not, they all go to Philadelphia where there's a collective of people from New Mexico. So it's a real challenge. The other challenge is what's the role of the different providers in the marketplace? So what's the role of the community health worker? What's the role of the physician assistant? What's the role of the nurse? What's the role of the specialist? And right now, there's a real gap between those going into family care or psychiatry, which there's a real shortage of, and those who are going into radiation oncology or into orthopedics are the ones where there's a higher rate of return for their efforts. So you have a real challenge. The U.S. government also has a program now on training physicians. It happened during the time I was in training, then they stopped it for whatever the political reasons are, and now they're trying to enhance it. If you go into another sector of society, it's even worse than in Dixon, Illinois, is the Native Americans and Indian Health Service. It's understaffed and underfunded. So these people are having a hard time. So your question is a very profound question that has to be addressed in a meaningful way. And it should cross between one side of the political spectrum and another. It should go from past to the future with a much more dynamic answer. And then that's a longer story, but your brother's definitely doing the right thing at the right time, but it's not the perfect person for that job now. Anyone want to add to that dialogue, the diatribe?
Yeah, I would. we've had this conversation. So my personal solution is now that I'm going to have 4 kids, 2 of them are going to take over the farm and 2 of them are going to med school. So that's my personal solution.
It's a good family plan.
So if you've
Well,
got,
I don't know if that's an answer to the medical field or
Do
not,
that.
but we'll only time will
Good
tell.
family plan.
tell them to flip a coin, some get the,
Any other questions? We're right on schedule, so you make sure that you have ample time for whatever else you want to do.
So
Sure,
I'd like
over
to,
here.
if I could, Phil, real quick, I'd like to address the recruitment. I think part of the challenge is also that, especially new graduates that are going to be providers in rural communities are incredibly intimidated. Our education system is largely based on team medicine now. It's a very collaborative environment that they're learning in. And it's very intimidating for a new physician, no matter what your specialty, to go out and sort of be on your own. And so again, I'll talk about a little bit about how telemedicine can play a role in that. 85% of our customers in rural communities, which are hospitals, of course, suggest that having telemedicine helps them recruit physicians to their area because they feel supported. They have a collaborative resource that they can leverage. They're not going it alone. And that has changed a lot, I think, in healthcare over the last 50 to 100 years in terms of that really team-based medicine approach. You can imagine, young doctor, very intimidated to go out and sort of go it alone in the frontier, if you will.
Or, and I'll just say this about that, especially in a primary care setting, because oftentimes what shows up in primary care is actually mental health. And so if you have a primary care provider in a rural community and someone comes in and you didn't have a conversation about depression, anxiety, who can they consult? And so that telemedicine piece really helps to provide that wraparound holistic care. So that's a valid point.
Okay, we got a question over here, sir?
Yes, name's Jason Moss. Had a question. I thought we were going to talk about healthcare costs, so I've got a question on dollars and cents. For those of us who buy health insurance, right now our ability to choose between prices, for an example, is choosing between, let's say, gold, silver, and bronze plan, where we can see the differences between what my monthly premium will be and what my copay type of cost will be. And as farmers who can, cash flow more than, it'd be kind of like going to to buy a car and the salesman's only talking about what your price per month is going to be. Well, as farmers, if there were more ways to influence what our net cost of health insurance will be, I think we'd be open to it. I've got a wife and 5 kids. My health insurance is about $24,000 a year, and I have an out-of-pocket maximum of 12, let's say. So I know that the least I'm going to pay is 24 and the most 36. If someone gave me an option to write a check for $32,000 on January 1, I would do it. The same as we write off big checks for seed or chemical or fertilizer. And I know HSAs kind of do that, but right now that's where that spectrum stops of, but for those of us who could cash flow, no premium for a while or write the big check just to get our total cost lower, is something like that even possible? Or is it all in terms of what's your monthly premium going to be, and we're stuck with the same suite of ways to buy health insurance like people in the city?
Okay. Dan, you want to take a shot at that one?
Absolutely, I'll take a shot at that. A couple things related to that. Number one, we have lost somehow the ability to link the health of the group or the person with the actual cost. So the answer is, in some cases, your $25,000 or $30,000 a year for the risk that you bring to the carrier or the insurance shouldn't be 25 or 30. There's a blending of that from a community rating standpoint, that we need to make sure we have safety nets for those on the one end, but that we simply put the risk and reward in that process to make sure we do that. We are looking at, as one of the things that we're looking at, a pre-buy process to where there is a discount if you pay 12 months in advance from the cash flow standpoint of that. So it's something that's just coming into a business principle in the health insurance world that you don't see a lot of people embracing right now, but we are looking at it because we recognize obviously there's some value in that as well. So it's really a combination of both from a cost standpoint.
Is there another question? Because I want to be sensitive to our time constraints, and also I want to give you a one-liner to take away with you. Do we have another question? Sure.
I just wonder if you think health insurance companies have a database that, you know, let's say they know that this person is this age, weighs this, has this problems, this medical problem, maybe it's depression, maybe it's diabetes. Do you think they know their patients and tendencies? They have a database that piles all that stuff up, or you think it's all just kind of research and government kind of guidelines?
Well, I think that's a very good question. I think it's quite complex. I can give you stories, I'd rather not mention the names, where they collected innovative data in the big, new side of artificial intelligence, and they hyped the database. So they said it was giving them more than they actually got. I can tell you the other story where there's a company out of Boston that collects data to help people in focus groups and then sells it to pharma. I can tell you the other side, which is very positive, where there's some great data coming out of the Centers for Disease Control talking about healthcare disease metrics and the like. So your question is better than any answer can be provided. Some do it better, some don't worse. It should be, as they said, more locally oriented, so you should have a local database. I think that's what you're collecting here with FBN is great, and it should go into the healthcare space. It's challenging. And to the question that this gentleman over here, so I would only ask you to think about putting the cost issue in the quadruple aim. Lower costs with better care, better health, and satisfaction. Because just cost alone, you might be paying your $36,000 a year. Someone may be paying a touch more and getting better care or worse care. So try to be transparent on what you're getting for what you're paying for. And what I do, now I'm talking as a physician, always ask your healthcare provider the opposite question. It's a role reversal. So if you have an issue, go into the physician or the nurse and say to that person, let's switch places for a moment. If you're in my place, how would you act? Because all of a sudden they give up their professional title being doctor and they're thinking more in line with you. And then one last line that I'd like to give
I was going to say, Phil, can I just add one comment?
Sure.
On the data? Short answer, yes. Slightly longer answer, absolutely. Every one of these companies does. Whether it's your provider, whether it's your insurance company, absolutely, it's all data driven. And quite honestly, it's probably one of the better things that's happening in healthcare. Because if you think about evidence-based medicine, the whole idea of evidence-based medicine is to reduce practice variation, improve outcomes. They can only do that on using a mass amount of data and analysis and everything else. So do they track data? Absolutely. Everybody does on every point, whether it's clinical data, technical data, remittance claim data, you name it. I played in that space a long time, and the sophistication there is absolutely there.
And I think the emergence of accountable care organizations as well is tremendous. It's a new sort of trend, if you will, but it really focuses that effort, leveraging data and rewarding health organizations for actually reducing costs for their patients. So this is definitely something that I think is going to be transformative in healthcare as we move forward.
Early on, I said it was okay to be politely in disagreement, but not be disagreeable. So let me be politely in disagreement. 5 years ago, the American Academy of Internal Medicine did something called Choosing Wisely. And they chose for every profession in medicine the 5 evidence-based information which doctors should change their practice on. Make sense? How many x-rays should you be getting? How many prostate exams should you be getting? And what they found out 5 years later, that few of the professionals listened to what their professional societies told you. So I would say data is critically important, unbelievably important, but making sure what the data says is acted on, not just talked on. So that's my perception. So let me leave you with one line. In these times, if I is replaced by we, even illness becomes wellness. Working together as farmers, we will get a healthier farmer community, a healthier nation, and a healthier for our next generation. So I'd like you just to think about, in these times, what it means if we act together collectively to make a change, because I wouldn't leave it to every silo to work unto themselves. That's my political neutral expression for this great session. And let me thank the speakers up here, each one of you. It's not an easy issue. It's not going to happen overnight, but all of you have to put your pedal to the metal, your foot to the pedal, whatever you want to say, and make it happen. So thank you very much for being with us this afternoon. Good job.